Hi, everyone. Welcome to this community roundtable. My name is Gigi deFiebre, and I work with the Siegel Rare Neuroimmune Association. And I am pleased to be joined by Megan and Julie today. So just to start and give kind of some introductions for those who are listening, do you mind just telling me, your connection to rare neuroimmune disorders or, TM specifically? Megan, do you want to start?
Sure. Hi, I'm Megan. I was diagnosed with transverse myelitis in July 2018. Found out about it was called the Transverse Myelitis Association right after I was diagnosed. So I've kind of been involved since then. So, yeah.
Great. And Julie?
I have had TM since 2008, so 15 years. And I found the SRNA, which was the TMA at that time, right away, as soon as I got out of the hospital. And the first person I talked to was Debbie Capon, and she was great. She told me her story and helped me quite a bit. So that's kind of where I'm at. And I am also a support group leader for Tucson area.
Great, thank you. And yeah, just as also some background too, I was diagnosed with transverse myelitis in 2009. So, and also found the at the time the TMA, not SRNA, but yes. Yeah. So I'm just going to add in this banner here that people can see, hopefully. Yes. So in terms of thinking about how your life has kind of changed since your diagnosis, can you talk a little bit about how it has changed, what has changed, how it has changed, and how you have found maybe a new normal, and if so, kind of how you got to that point, that new normal? Julie, do you want to start?
New normal. I would have to say that on a daily basis, I have to find a new normal. My life has changed. Mostly people tell me my personality has changed, which I find interesting. I'm still pretty upbeat, but my husband says I'm not as bubbly, which I find interesting. But every day I work on it, to try and get back to where I was, But I was paralyzed from the waist down, but I do have mobility. So what changes is the daily pains, the daily aches, dealing with all of that everyone else I hear on here talks about. I have bands, I have bladder and bowel issues, I have all those. So yeah, it's a daily thing for me. Is all I can really say as far as how my life has changed and whatnot.
Yeah, and how, in terms of kind of, so you say every day you kind of find that new normal. Is that something that you get up in the morning and you kind of assess the day, or how have you what's that process been of finding that new normal for you?
The process is, I go with the flow on everything. So, and I never used to do that. I was a planner, so that part has definitely changed. I planned everything and always had everything, set in stone. Now, not so much. I let everything go with the flow. It's much easier on me and everyone else, so.
Yeah. And Megan, do you mind talking a bit about how your life has kind of changed since your diagnosis?
Yeah.
And this idea of this new normal?
Mm-hmm. So my transverse myelitis was a little different. I didn't have as much of the motor component. I did have weakness, but mine was more sensory and autonomic and those kinds of things. But I think my new normal, as I've kind of learned, like, to be grateful for what I can do. I feel like my endurance is not where it used to be, so I have to take more breaks, and I kind of have to build that into my day. And like Julie, I have like sensation issues and pain and things like that. it's not always the same. Every day is kind of different. So like when I get sick, it kind of triggers things, and that's when I feel worse. So I might have to take breaks or rest a little bit more than most people. But yeah, I feel like it's part of me, but doesn't like define me, if that makes sense. For a while, I was kind of almost like denying the issues that transverse myelitis brought me. And then I kind of came to terms with what I was actually dealing with. So it's still a process. It's been 5 years, but it's still a process for me. So I'm still kind of trying to figure it out. But
Definitely. Yeah. I mean, I'm 13, 14, almost 14 years out.
14 years.
I'm starting to get, lose track of the amount of time, right? But it definitely, there is that, I don't know, it took at 5 years out, for example, I don't think I had fully kind of come to terms with my diagnosis or fully really accepted that, how it was impacting my life and all that. So I think it's definitely a transition process for a lot of people. So, but yeah, I'm going to put on another, thank you both for sharing. I'm going to put, and Megan, you talked a little bit about this, where you said it kind of doesn't define you, I think, at the end there. All right. So on the screen here, it says, if you're comfortable sharing, how do you view your diagnosis in terms of how it fits with your own personal identity? Yeah. And so I'll just start quickly, just because I feel like this is something I'm thinking about a lot recently. And it, at first when I was diagnosed, I didn't want it to be part of my identity at all. I very much pushed it to the side. I said, this isn't me. Everything I identified with before was who I was. And I think that really has changed a lot in the past few years, especially getting to know other people with transverse myelitis or other disabilities too, has really kind of transitioned my view of who I am. And I identify as disabled, and I don't see that as a bad thing. It's just part of my identity and my experience. But that, again, has also changed so much over time and has transitioned so much. So Megan, do you want to start?
Yeah. So again, it's been 5 years. I feel I'm still kind of coming to terms with everything, but I do feel like it's part of my identity. But again, it's not like the only thing that's part of my identity, if that makes any sense. I kind of struggle with the term disabled at times because I'm an OT. So I treat a lot of patients and students. I'm in this school setting now. So I kind of struggle with that just because I didn't really have any issues. And then I got transverse myelitis. And so that's still a struggle with me, that term. And I'm not sure why, because I know it's not a bad thing. I think I'm just still trying to come to terms with it. But yeah, it's definitely part of me, and it's changed like my perspective on things. I feel like I can relate to when I used to see patients at home health, and now I see students in a school setting. So I feel like there's been positives for the experience that I've gone through as well. Not just, there's obviously some bad things that come with it, but I do feel like it's part of me, but it's not the only thing that's part of me, if that makes sense.
Yeah, I definitely think as an OT, it makes sense because you're using that, the goal of OT is to help people with, depending on, I guess, your focus, but OTs have done a wonderful job for me, for example, in helping me figure out how to do things like get dressed or do these things that my disability has changed or made more difficult for me to do. So, I mean, that makes total sense that those two kind of worlds are, there's an interesting overlap there. But as an OT, your perspective as someone with transverse myelitis, that must, I feel like it must be very good for your patients to know that you also have that kind of
some experience in terms of like different treatments and being in the hospital and stuff like that.
Yeah, definitely. And Julie?
I don't think it's ever defined me. I struggle with it at times. I did the This Is Me, and a lot of people that have seen the video with that probably have heard that sometimes I deal with people and my disability slaps me in the face. So like One time I was in a parking lot and a lady actually told me I couldn't park there because it was handicapped. And I was like, well, okay, do you realize that I am handicapped? Which is very hard in our condition because people don't sometimes see us as handicapped, people or people with disabilities. So sometimes it slaps me in the face and other times I just let it, you know, go. It doesn't define me in that way, at all.
Yeah, and so in terms of, I don't know if you consider yourself as having like more kind of like an invisible disability or one that's
Yes.
okay. Yeah. So
Yes.
because for me, it's very obvious that
Yes.
I have I use a wheelchair.
Yes.
I have my hand functions not great, but so it definitely is more. But in terms of experience with maybe having more of a quote invisible disability,
Yes.
what has your experience been like with that? If you don't mind sharing.
Very, very hard because people will for instance, one of the things I struggle with is when I go into a store, I'm very good. I use the I've become my mother. So I use the cart as my walker, basically. So I always have a cart, so it's like that changed. I never used to have a cart if I didn't need it. And people just don't see some of us that are able to walk and stuff. They don't see it. I know when I was first sick, this is a story that's kind of funny. I used to speed around people all the time. I'm going to go off key here, and I never realized how fast I walked around people until I was sick and I had my walker and people were flying by me. And I'm like, do they not know I don't have any balance? And my mom looks at me and she goes, gee, this is a good experience for you. You're learning how you used to be. So it was a big slap in the face. And I go, you mean I used to walk around people like that? And she's like, yes, you scare people that are old who, that can't stand up and stuff. And they're scared of you. And I'm like, okay, I won't ever do that again. And I don't. So, as far as if that answers your question, Gigi, I'm not sure.
Yeah, definitely. Megan, do you have anything to add in terms of your experiences?
Yeah, I think that's like my struggle in terms of like giving, like, I guess saying that I'm disabled or have a disability is just because I feel like most of my issues I deal with are not visible. So I guess like there's almost this fear of like saying that I'm going to get a backlash from other people. And that's kind of an issue with our society. But
Yeah.
so I think that's kind of where my struggle comes from, is because of most of the things I deal with aren't visible. I'm afraid somebody's going to call me out. So I kind of understand what you're saying, Julie, too. When I was first diagnosed, it was a little bit more visible. I had some weakness, and so I had to use like a rollator and like things like that. But now it's not so much. I seem like I'm functioning fine, but in reality, there's still struggles. So I definitely kind of relate to the whole invisible disability thing.
Yeah, and I think also even just beyond kind of the mobility aspect of it, too, with people not realizing that people can deal with neuropathic pain, for example, and how that can be really debilitating and really impact someone's day-to-day life, or issues, with bladder and bowel dysfunction or something,
Fatigue.
Yeah, fatigue. Fatigue is a big one. Fatigue.
Mm-hmm.
That's one, and that's hard to explain to people as well. How do I'm just so tired I can't function. Like it's just that's always a challenge too. So yeah, I think it's important to kind of highlight all the different sorts of ways that transverse myelitis can have an impact on someone's day-to-day life, because obviously seeing someone using a wheelchair or walker is much more visible or apparent, but there's all these things kind of underneath the surface too. So, so yeah, thank you both for sharing that. I'm going to add another question here that says, what advice would you give to patients about how they can advocate for themselves with medical professionals? And I think this is a particularly important question for a rare condition like transverse myelitis, where maybe your medical professional doesn't know a lot about TM. So Megan, do you want to start?
Sure. I'm still kind of dealing with this in terms of trying to advocate for myself. When I was first diagnosed, I wasn't the best at doing it. But just like trying not to downplay your symptoms and just like actually going into the doctor's office and saying like what your symptoms actually are, and trying to like, I forget, so I get nervous when I go into doctors. So maybe like writing it down and being like, these are my symptoms. Is there anything you could help me with? And then maybe even bringing up certain things. I know when I was first diagnosed, they weren't going to treat me with steroids. So I kind of had to almost advocate for that. So yeah, just using like any, resources you can find to try to advocate, because a lot of doctors haven't seen people with transverse myelitis and don't have a lot of experience with it. So just bringing any like research to their attention can be helpful too.
Yes, very. I'm glad you advocated for that. That was good for you. Good for you.
Yeah. Julie?
Yeah, I have had to advocate, and I still have to advocate sometimes. My neurologist has only seen one case of NMO SD. And so I constantly am, after I come to the seminars and I come to these things, and then I go back to him and I'm like, hey, can I test? Like I wanted to test for the Aquaphor and 4, is that right? Do I say it right? And he's like, oh, you don't need that. And I'm like, what can I get it? And he's like, no, you don't need it. So then I decided, okay, well then I'll just go to my, general doctor and ask her. So I have learned to advocate for myself a lot. And I think it's very important for all of you people, anyone, to make sure you advocate for yourself. If you can't, find a friend, find a nurse friend. They're the best. Or like you, Megan, find someone like you that's a, occupational therapist that can advocate for you if you can't. Because some people can't.
Definitely. Yeah. It's a challenge, and especially, finding medical providers who are willing to listen and also maybe work with other. So if you have a neurologist who doesn't know a lot about transverse myelitis, finding someone who's willing to then talk to other providers who actually do know a lot about transverse myelitis, that can be one way to make sure that you're kind of getting the best care that you can. It is, it's a partnership, or it should be, in that, ultimately the care is about you as a person. So, having that kind of open relationship with your medical provider could be challenging, but very important. And then similarly, what advice do you have for people who are newly diagnosed? So someone who's either, just in the hospital or just got home. Julie?
The first advice I'd have is, when they tell you that you're not going to get much better, don't listen. Definitely do not listen, because there's so much out there, especially with the SRNA, that you can get better. You can get better. It's not all bad. And even, if you are like Gigi and in a wheelchair, your life is not over, So definitely stay positive. Staying positive is a big factor.
Yeah, Megan?
Yeah, I agree with staying positive, and yeah, just trying to take it day by day, hour by hour, minute by minute. I also feel like for me, like I never like let myself feel the emotions with everything I was going through. So I feel like it's also important to feel that, because if you don't feel that, it can come back later and then cause some issues. So I feel like it's important to stay positive, but also let yourself kind of, if you feel like you need to grieve or feel your emotions, especially if you're going through hard times. I also feel like it's important to kind of research, so you can kind of learn more about your disorder, but not research too much. I kind of went down the rabbit hole and kind of scared myself of some things. But yeah, research, but not to the point where you're like, that's all you're doing. So yeah.
Mm-hmm. What advice would you give, Gigi?
Yeah, this is a tough one because I often talk on the phone to people or via email to people who are newly diagnosed. And it prompted me even to write a blog for SRNA about it, just because it is such a kind of tricky time in people's lives. And so when I've spoken to people before, they typically ask if I, share that I was diagnosed with TM in 2009. They'll say, oh, how are you now? Like, are you up and walking? Are you doing okay? And I'm like, I have to say, well, no, I'm not up and walking, but I am doing a lot better than I was. And I, have figured out kind of how to live my life. And so it's hard as someone who I think, does have continued, pretty severe mobility issues, to tell someone who's newly diagnosed in that hospital bed and not have that then have them, lose hope or something. Because at the beginning, as we know, you don't know what's going to happen. People can become really severely impacted at the beginning and recover pretty well, or it could be, it just depends. And so trying to communicate to people that it's still very, very early, and then the fact that it's also it's a marathon, not a sprint, which is not something anyone really wants to hear when they're newly diagnosed with something, but it's the reality of the fact that this isn't, I kept thinking, oh, I'm going to get better in 3 days. I'll be up and walking around. And because I had a trip planned, I was like, I'm going to get on the plane that I'm supposed to get on in 3 days. So knowing that, no, this is, you're kind of in this for the long haul for a bit, but there is, even if mobility, people focus, I think, on mobility a lot at the beginning, because that's, I think, that's what impacts you kind of immediately with the things and how your life has to adjust. But even if mobility doesn't kind of come back the way that you had hoped or expected, there are still so many ways, and through the help of OTs, for example, ways to adapt and adjust and continue on and live your life, a full life, in using a wheelchair. I mean, I see my wheelchair kind of as a tool for my freedom and my way of getting through the world. So yeah, I would say for newly diagnosed, to, again, it's marathon, not a sprint. So keep that in mind. There's still so much room for things to get better and for things to improve. Make sure that the medical providers are doing what they should, making sure that they're ruling out everything, making sure that they're listening to patients. I mean, I tell people that too. If they feel like their physician is not listening to them or not willing to kind of admit what they don't know, that I think can be an issue for people who are newly diagnosed, and making sure that they get the treatments that they need and starting stuff like physical therapy. And if open to it, connecting with others with rare neuroimmune disorders or other disabilities. And I know that can take some time, but yeah. Sorry, that was a long answer. This is something I think about frequently in my conversations with people. So yeah.
Everybody's different too, when you're talking to people, what they're going through, so kind of have to go with the flow of what they're feeling,
Yeah, it's definitely kind of customized too, right? Based on the person's experience. There are those kind of universal things that everyone, I think, experiences there, but then there are these individual things. What do you do if your house is not accessible and you need it to be, or there's just these other things as well. So let's see, I have another question here. I'm just adding it to the banner. So what made you decide to get involved with the SRNA community? Julie, do you want to start?
Mine is easy. It's an actual name. Her name is Barbara Sattler. I met her when I talked to Debbie Capon. Barbara lives in the same town I do. So when I met Barbara, we just connected greatly and have been fast friends ever since. And she, wanted to do a support group. And so we started getting more and more people involved. And she was involved with the SRNA already. So she kind of just clicked me right in, and I enjoy it. I enjoy all the people I meet. I have a great time with all you guys.
Great, thank you. And Megan?
Yeah, so I was actually trying to just find more information about transverse myelitis. So as an OT, we learned about, I thought what were relatively rare diseases at the time, but I have never heard of transverse myelitis. Originally, they thought I had multiple sclerosis, so I, kind of knew a little bit about that. But yeah, I was just trying to figure out information on the internet, and it kind of led me to what was the TMA or the SRNA. And I kind of just, that's kind of how I found it. And it was nice to know people who had similar diagnoses because I didn't know anybody at the time. So it was more me just trying to figure out information. It kind of led me to the website. So yeah, it was like, right. I think it was almost like 2 days after I was diagnosed, I found it or something. So it was pretty soon. Yeah.
That's good, because that's always a challenge to make sure that we're trying to find people early on in that process, and it just kind of depends. So it's wonderful that you got connected kind of so soon after.
Yeah, and I was going to say, Gigi, I think you were one of the people I originally talked to, and you were trying to get me to get back into the hospital to get steroids. So that helped me too. So thank you.
Good to hear. Yeah. It's, again, the goal is people would find us, right away. Although we also don't want that information overload, Megan, that you talked about too, where it's like it can be too much sometimes, and so you do it in little bursts, and also providing information that isn't absolutely terrifying too, because I think my family withheld, I think they were handed a piece of paper, or like 12 pieces of paper with a whole list of everything, and I think the thing that stood out to them was, it said something like people don't recover until 2 to 12 weeks or something. I don't even know if that's where that came from or what that information is from. And they were like, we're not going to share this with her right now. Yeah. They kept it from me, and I wasn't ready yet then either, I don't think. And I couldn't use my phone at that time either with the way my hand function was. But yeah, trying to balance that, getting the information you need to survive and to make it through this experience in a way that is, gets you in a good place, but not also completely being overwhelmed with a lot of information, and some of it can be a little scary and overwhelming. So
they did that with my husband too. They gave him a whole list of papers, and he didn't give it to me either.
Yeah. I don't know what I would have. I think it was smart that they
Yep.
did. My family did that. I don't know what I would have done if I had read.
Yeah, see, I don't think I got a lot of information. Like, I had to research it all on my own. I didn't get much. It was just like, like inflammation of your spinal cord. That was about it.
Yeah. I mean, then it really varies. People's experience with that too really varies. It's either sometimes, you're given too much information over, and sometimes they're like, they don't even necessarily explain that it's inflammation in the spinal cord.
Right.
You get the name of the disorder, and you're like, good luck. Which is not.
This is what you have. Go on with your life.
Yeah. And then you go home and you look it up, and you're like, wait, what?
Yep.
Yeah. There's definitely work there that needs to be done in terms of what medical professionals do, right, with those who are newly diagnosed, and how they present this information to people too.
I think though that, like Dr. Greenberg and the doctors, I actually think they're helping, because it seems to me it's more, it's out there more than it was when I first got it, 15 years ago. It seems like it's becoming more and more known, which is good, because doctors really need to know more about it.
Yeah, I almost feel like there's more knowledge in the past 5 years, because I have a new neurologist. Yeah. The last neurologist moved, and he knows, I feel like, a lot more in terms of like, because he was just like rambling about all this stuff. And I was just like, how do you know this? Because I don't feel like my last neurologist knew as much. He had to consult once I was getting steroids and stuff. So yeah, so I think maybe even in the past 5 years, and he's younger, so maybe, you know, like medical school is going over things more.
Or learning. Yeah. Maybe it's out there more. Yeah.
Yeah. It's, I think as also we're learning about other rare neuroimmune disorders like MOG antibody disease and NMO. I mean, there's just so much from when at the time TMA started in 1994. I mean, there was nothing available. And so just thinking about that versus now.
Yeah. Even my 15 years, because that was like over 25 years ago. Yeah. That the TMA started.
Yeah.
Wow. Can you imagine not having any information? That's scary.
Yeah. And the internet was obviously in the very early days.
Yeah. I was gonna say. So couldn't Google it just like boom, you know.
We did. I don't even know if Google was
It's around. No, I don't think so.
Yeah, I know. Just logging on to AOL and seeing what's there. Yeah.
Yep.
Yeah. So we did get a question to the Q&A and just asking if you go back and say a few words about IV and oral steroid treatment for people with TM, and kind of maybe what treatments you did get. I mean, Megan, you're a medical professional, but not a neurologist. But talk a little bit about kind of what treatments you got when you were first diagnosed. Megan, do you want to start?
Yeah, so I got 5 days of IV steroids. I'm not exactly sure what the dose was, but I think it was the max or whatever they recommended. And they didn't really tell me the side effects going into it, but like I had trouble sleeping. And then I unfortunately didn't get like a taper dose. So I went from like having 5.
Oh.
I know. I think about it now. I'm like, that's not good. But I went to go like an insane amount of steroids over 5 days. And then once I was discharged, I didn't have anything. So I didn't have any oral steroids. So I almost felt worse when I came home because I think I was like almost going through a withdrawal of the steroids I was on. But in addition to the steroids, I was also on other medications. I was on like baclofen. I was on oxybutynin. I'm not sure if I'm saying that right, which is like a bladder medication. I was on, and then I was on some pain medication as well. So those are the treatments I had first. And then I went into like physical therapy and things like that. Yeah, I'm not sure if the IV steroids worked or not because I don't know. Like I don't have I can't compare it to if I would have gotten it or not. But I definitely wanted to try it just because that was what was recommended. So.
Okay, I can tell you, they work wonders. For me, not for everybody, but when I was first diagnosed, I was paralyzed from my waist down. And within the first, I want to say 6 hours, I was able to start moving once they started the IV steroids because I had so much inflammation in my spinal cord that was keeping the nerves from communicating. And that's why I couldn't move, So I wasn't, completely paralyzed. So as soon as those IV steroids started kicking in, and I think I was on the 5-day, they must have a set thing that they give you of IV steroids. And then I went to occupational and physical therapy after that. So definitely helped me.
Yeah, I also, so when I was the night I was diagnosed, I got IV steroids and I got them for 5 days. Yeah, I was diagnosed pretty, I don't know if it's because I couldn't move at all. And so
right.
I don't know if it helps when you're, I don't know, but they immediately.
It's different. That's for sure.
Yeah. So I was definitely lucky in that I got steroids that night. I got IV steroids for 5 days. And then I didn't experience any recovery from it. Again, not saying that they didn't help. It's, as Megan said, it's so hard to make these individual, when we look at kind of bigger groups of people, IV steroids, do seem to help. And then you typically do a taper with steroids, yes. Decrease the dose over time rather than, because the IV steroids are a pretty high dose of steroids. So trying to kind of, you slowly reduce the dose over time. And I also did receive plasma exchange as well. I don't remember if it was 5 or 6. I think I did it every other day, where I had to get a port put in my neck, and it kind of filters your blood. And so again, I don't know if that helped, but I'm glad I'm glad we did all the things that we could do at the time to kind of treat my transverse myelitis. And I also got, until kind of tests came back, I got antibiotics and antivirals as well, just to kind of rule out any of those issues. So, these are the treatments that are commonly done. People sometimes also get IVIG as well. And so, it's something that if, this particular person should really speak with their doctor about, and come up with a plan that they're both kind of comfortable with moving forward. So yes, thank you for sharing a bit about your treatments there. And then I have this kind of non-transverse myelitis related question, which is what's one thing you're looking forward to in your life this year?
This year, wow.
I know. Let's see.
That's a deep question. Go ahead, Megan.
Okay. I was going to say, for me, I'm looking forward to traveling. I'm hoping to travel this summer. I'm not sure where. I haven't really figured it out yet, but that's something I look forward to. Is traveling. So yeah.
Awesome.
I think that's going to be mine too. I have a girlfriend that just moved to the coast. So she's in Washington State, and she's right on the coast there. So I'm looking forward to going to her new house. So I'd have to say travel too.
Very nice.
That's definitely one of the things I'm looking forward to.
Very nice. Yeah, this is not exciting at all, but I am very much looking forward to just taking some time to relax and chill out, because it's been, I was in school for like almost my entire life, and have had some time now, hopefully this summer, just to take a breather, or just, it's good to do that as well. I like traveling too, but that's kind of what I'm looking forward to in the next few weeks and months. So trying to prioritize and do that more.
Good.
But yeah. Any other kind of final thoughts or anything you want to share with folks watching? Kind of leave it open to both of you.
You want to share? I'd have to say, just don't ever give up, and always try new things. I mean, I'm still trying new things all the time, especially with pain, because I have a lot of pain in my back. So I'm constantly trying different pain medicines, or do different things like acupuncture, just try different things. Don't ever give up on anything.
Yeah, definitely. Megan?
I agree. Yeah, just for me, I think when I was first diagnosed, I was looking almost too forward in the future. So just kind of taking it day by day, trying to just not worry too much about the future, and just taking it day by day. I think this has kind of helped me live in the present more. So, I mean, there's some benefits almost to being diagnosed with something like this too, because it's just it helps you kind of be grateful for what you do have and kind of be present. So I know it takes a while to get there, but yeah, so don't give up, just keep going and take it day by day. So
yep,
definitely. Yeah. And that's kind of just, I feel like there's no end point to taking it day by day, right? It's kind of for me at least, continuing to try to do that every day and all of that. So yeah, thank you both so much for sharing and being open about sharing about your experiences. Just want to tell, for those listening, if you want to be part of conversations with others in the community like this, you can consider attending a support group meeting, or being matched with a peer connect leader. So that's someone that you can chat with one-on-one if this kind of bigger support group meeting setting doesn't feel right for kind of what you're looking for. So those are two really good options. And yeah. And then also there's a lot going on today in terms of the event, but after this, just head over to the expo area to view a talk on identifying relapses versus a temporary worsening of symptoms. So thank you again so much. This was wonderful.
Thank you for having us.
Yeah, thank you. I appreciate it.